Hello, my name is Steve Mudra. I work as a pain management doctor for the VA. This DVD is going to counsel you on opioid safety. You may also interact with our nursing staff, with a pharmacy specialist, or with your primary care provider. Opioids are medications that are used to treat pain. Opioids are also called narcotics. These include oxycodone or Percocet, hydrocodone, also called Lortabs or Vicodin, methadone, morphine, fentanyl patch, and OxyContin, which is a long-acting oxycodone. Who needs opioid safety counseling? I would say anyone on long-term opioid therapy, or family members or supportive others of veterans who are on opioids. We're going to review all the parts that cause chronic pain and how we might offer improved pain care. We're going to review the VA opioid agreement and a pamphlet called Taking Opioids Responsibly, which are both about opioid safety. The next time you're with your primary care provider, they will ask you to sign the opioid agreement, which verifies that you've reviewed this information. The goal for today is patient education to make sure we have given you the potential risks when opioids are used. Patients in the VA on opioids will be asked to sign a written informed consent if opioids are to be taken for longer than 3 months. This consent is meant for your safety and to educate you and your family or caregiver about the risks of opioid therapy as well as the potential benefit. Opioids are very powerful medications that can lead to severe side effects and even death, sometimes even when taken as directed. We used to think there were no negatives using opioid pain medicines. Opioids were promoted for non-cancer pain by the medical community and the drug companies in the late 1990s and early 2000s. Opioids were said to be very safe at any dose, with little chance of causing addiction or side effects. These things didn't turn out to be true. The Centers for Disease Control, or CDC, has declared that the United States is in the middle of an epidemic of deaths from prescription drug overdose. Opioid overdose is now the #1 cause of accidental death. Opioid pain medicines are now responsible for more deaths than the number of deaths from motor vehicle crashes or deaths from cocaine and heroin combined. The majority of deaths occur in patients when they're taking the medications as directed. There is a dose-related overdose risk. Higher doses of opioids are more dangerous and more likely to cause an accidental overdose. For your safety, if opioids are a good treatment, it's very important to get you on the lowest dose that will control your pain and improve your function. Written and informed consent includes the need to ask. Your doctor will ask about the reason that long-term opioid therapy is being used, information about the location, timing, and other parts of your pain, and your goals about your pain care. Your goals may include such things as going back to work, climbing stairs, walking short distances, sleeping through the night, doing daily household chores, or starting a light exercise program. You may already be taking opioids, or your provider may try to give you opioids to find out if they will help you. You may try them for a short time or continue them for the rest of your life. Your provider will watch your progress and learn more about your risk and side effects when you're trying them. If the risk and side effects outweigh the benefits, your provider will stop the prescription. If your provider continues your opioid prescription, the goals of your treatment may change over time. The names and the doses of your opioids may also change. You will not need to sign another consent form for these changes. You may be asked to sign another consent form if you seek opioid care from another VA provider. Your provider will monitor your prescription. This may include checking how often you refill and renew your prescription, counting pills, asking you about your symptoms and testing your urine, saliva, and blood. The VA does not use these tests for law enforcement or employment purposes. The results of these tests may cause your provider to talk to you about keeping or changing your pain care plan. Providing a urine drug screen when requested is a mandatory part of safe opioid use. Failure to provide a urine drug screen or non-compliance with treatment follow-up could be a reason to stop opioids. If you do not take opioids responsibly, your provider may stop your prescription. For example, if you do not let your provider monitor how you are responding to the opioids, or tell them if you are taking other drugs that may affect the safety or how well your opioid treatment works, your provider may stop the prescription. Along with state law, they will also monitor if you receive any controlled substances outside the VA. Most states have monitoring programs that track unsafe patterns of prescription drug use. The VA and these programs may get and share information about you without your consent. If you receive controlled substances from two sources, it is likely your opioids will be stopped. We will review taking opioids responsibly to make sure that you know how to take your medication safely. You will be given a copy of this guide so that you can use it as a reference. When added to other treatments as part of your pain care plan, opioids may reduce your pain enough for you to feel better and do more. It is unlikely they will stop your pain completely. It is possible that you may not receive any relief from this therapy alone. Treating complex chronic pain is a difficult process that doesn't have a simple answer. There's not a quick fix or generally one therapy or medication that is best. The approach to complex chronic pain usually requires multiple therapies and having the patient engaged in their care with some form of exercise, weight loss, physical therapy, smoking cessation, reprogramming the brain to develop better pain coping skills, developing support systems within the VA, family, and community. Here is a video to help you better understand the parts of chronic pain.
Everyone agrees that pain is a universal human experience. We now know that pain is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain. And generally, you'll be encouraged to stay active and gradually get back to doing all your normal things, including work. Or you might have had it for 3 months or more, and this pain is generally called persistent or chronic, because in this type of pain, tissue damage is not the main issue. What's less clear, though, is when you're told you have chronic pain, is knowing what's best to do about it. Well, in Australia, chronic pain is a really big problem. In fact, 1 in 5 people have it. Having a brain that keeps on producing pain, even after the body tissues are restored and out of danger, is no fun. Some people say it still feels like they must have something wrong. But that's just it. Once anything dangerous is ruled out, health professionals can explain that most things in the body are healed, as well as they can be by 3 to 6 months. So, ongoing pain being produced by the brain is less about structural changes in the body and more about the sensitivity of the nervous system. In other words, it's more complex. So to try and figure out what's going on, you need to retrain the brain and nervous system. To do this, it's helpful to look at all the things that affect the nervous system and may be contributing to your individual pain experience. What can help is to look at persistent pain from a broad perspective, and by using a structured approach and a plan, it's less likely that anything important will be missed. Let's start with the medical side. Firstly, taking medication can help, but only to a limited extent. It is the more active approaches that are necessary to retrain the brain. So using medications to get going is okay, and then mostly they can be tapered and ceased. Some people also think surgery might be the answer, but when it comes to a complex problem like chronic pain, surgery may not be helpful. So if you're thinking of surgery, it's best to get a second opinion and remember to consider all the things. Next, it is helpful to consider how your thoughts and emotions are affecting your nervous system. Pain really impacts on people's lives, and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things like smoking, nutrition, alcohol, and activity levels, and seeing if there are any issues is a good beginning, and these things can go on your plan. Then there's often enormous value in exploring the deeper meaning of pain and the surrounding personal story. By stepping back and looking at all the things that were happening around the time the pain developed, many people with pain can make useful links between a worrying period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear and where the brain does not protect by pain is best, and you'll gradually restore your body's tissues. So, to sum up pain, it comes from the brain and it can be retrained, and when looked at from a whole person or broad perspective, gives you a lot of opportunities to begin. So, get a helping hand if you need it, set a goal, and begin.
Working with your primary care provider on a joint approach to treating your complex chronic pain is very important. The VA is expanding the ability to offer many of these complementary therapies which have been shown to provide benefit treating pain. If opioids have not been effective with regard to controlling pain and improving function, some veterans will need to be slowly tapered from opioids. We have good evidence that we can offer improved pain care using a combined approach. So I would encourage our veterans with complex chronic pain to work with their primary care provider to receive the improved pain care you deserve. There are many alternatives to opioid therapy: heat and cold, stretching, exercise, weight loss, massage, acupuncture, chiropractic care, nerve stimulation, relaxation or stress reduction training, physical therapy, occupational therapy, mental health treatment, self-care techniques, counseling and coaching, meditation, rehabilitation, non-opioid pain medicines, injections, specialist pain care, surgery, pain classes, support groups, and attention to proper sleep. Possible opioid side effects include sleepiness or slow thinking, mental confusion, bad dreams or hallucinations, hard stools, intestinal blockage, itching and sweating, nausea and vomiting, decreased sex hormones, irregular or no menstrual periods, depression, dry mouth that can cause tooth decay, and allergies. Some other risks of opioid therapy include withdrawal symptoms if you suddenly stop taking opioids, lower the dose of your opioids too quickly, or take a drug that reverses the effect of your opioids. Some common withdrawal symptoms include runny nose, chills, body aches, diarrhea, sweating, nervousness, nausea, vomiting, mental distress, and trouble sleeping. Sleep apnea, which is abnormal breathing pauses during sleep, can be made worse by using opioids. You can have a worsening of pain. You can have impaired driving or impaired ability to safely operate machinery. Tolerance, which means that you need a higher dose of opioid to get the same pain relief, can occur. Addiction, a craving for a substance that gets out of control, can occur. Some patients become addicted to opioids even when they take their medicine as prescribed. Taking small amounts of alcohol, some over-the-counter medicines, some herbal remedies, and other prescription medications can increase the chance of side effects. Death can occur. There are risks in pregnancy. Continued use of opioids during pregnancy can cause your baby to have withdrawal symptoms after birth and require your baby to stay in the hospital longer after birth. Stopping opioids suddenly if you're pregnant and physically dependent on opioids can lead to problems during pregnancy. Studies have not shown a clear risk for birth defects with opioid use in pregnancy. If there is an increased risk for birth defects in pregnancy with opioid use, it is likely small. There are important safety considerations for all patients taking opioid medication. Always tell your healthcare team about side effects, changes in your pain level, or changes in your functional abilities. It is important to only get opioids from one provider. In case of an emergency, let your healthcare team know right away if you get opioids from another healthcare professional. Never sell or give away your medication. Opioids need to be stored in a safe place. Discuss disposing of unused or unneeded opioids with your healthcare team. Do not drink alcohol or take any street drugs while using opioids. If you're a woman, let your healthcare team know if you're pregnant or considering a pregnancy. Because of safety concerns, your healthcare team will check the prescription drug monitoring program in your state, if it is available, as well as a urine drug screen. Do's and don'ts. Do take your opioid and non-opioid pain medications as prescribed. Don't take any extra doses. Do inform all your providers that you are currently prescribed opioids. Do tell your usual VA provider if you get an opioid prescription from another provider. Do tell your VA provider about any health care that you're receiving from non-VA providers. Do tell your provider if you're pregnant or planning to become pregnant. Don't stop taking opioids on your own. Do be cautious about driving or operating machinery. Don't drink alcohol or take street drugs. Do get help from your friends and family. Don't sell or give away your opioids. Ask your healthcare provider on how to refill or renew your prescriptions. Make sure no one else can sign for or pick up your prescription. Keep your opioids in a safe, locked place, out of reach of family, children, visitors, and pets. Always store your opioids in the original labeled container. If you travel, carry the current bottle with you for safety. This will help you answer any questions about your medicine. If you are concerned about the safety of storing medicines in your home, tell your provider so he can talk to you about how to handle this problem. If someone steals your opioids or your opioid prescription, report the theft to the police. Working together with your healthcare team. Be honest with the healthcare team and treat them with respect. The team will be honest with you and treat you with respect. Be honest and complete when you report your health, drug, and alcohol history. You should also tell your provider about drug or alcohol use in your family. Speak up about your questions and concerns. Your provider wants to answer questions. Same-day care and emergency room staff are not good places to get treatment for chronic pain. If you have to go to an emergency room, tell the doctor about your pain care plan. If your provider stops your opioids because they're not helping, or because of addiction, abuse, or misuse, your provider will offer other forms of treatment for pain or substance use problems. Your provider will try to prevent or control any withdrawal symptoms. This typically, but not always, requires slowly lowering the dose. If you have partially used or unneeded opioids remaining from your prescription, your provider or pharmacist will tell you how to properly dispose of them. Thank you for allowing me to review this important information with you on opioid safety. We are committed to treating your pain and look forward to working with you to control your pain and improve your function. By working as a team, we can provide better, safer pain treatment for you.